Good morning, colleagues. Welcome to another engaging session. My name is Elizabeth Baini, a research specialist at Ilifa Labantwana, and I'll be facilitating this morning's discussion. Welcome. As folks are still joining, the Early Childhood Systems, Perspectives and Research webinar series is a joint initiative by Ilifa Labantwana, the Research on Socioeconomic Policy and Data Drive. And the aim of this webinar series is to explore the latest research and perspectives on a range of issues affecting the early childhood development service delivery ecosystem, and to create change for children through the promotion of data and research. So you are all welcome. Just a couple of housekeeping as we are getting ready for an engaging discussion. We've got a Q&A tab. Please put your questions in the Q&A tab. And at the end of the presentation as well, we're going to engage all the questions. You can also put your hand up at that stage to engage with the presenter, ask questions, comment, any additional inputs or insights from your perspectives will be welcomed at that stage. Just as a way of introduction, we all saw the disruptiveness of the COVID pandemic when it began in 2020, particularly for vulnerable households. So the pandemic disrupted a whole lot of lives, and the ECD sector was not exempted from it, right? So various challenges and changes in the landscape of early learning happened as a result of COVID and the resultant lockdown that came with managing the pandemic. So in trying to build back, we want to build back better. And for us to build back better, we need to know where to apply targeted interventions for effective recovery. And so it is apt that this morning's discussion, we want to explore some of the factors that still shapes participation rates in early learning, early childhood education, post the pandemic. And so we'll be looking at some of the demand and the supply influences in enrollment gaps in South Africa. And today we have the privilege to be, led by Dr. Eldridge Moses, who will be presenting his paper on the demand and supply sides influences on enrollment gaps in the country post the pandemic. Just as a way of introduction, a brief introduction of our presenter, Dr. Eldridge Moses is a senior lecturer at the Department of Economics at Stellenbosch University, who also happens to be a researcher at RESEP, that is the Research on Socioeconomic Policy. His research interests include spatial and racial inequalities, migration, urban inequalities, and economics of education as they relate to poverty and inequality alleviation. Through his work and partnership with RESEP, he has contributed to influential research projects on internal migration, fiscal incidence, access to education, and education quality. Over to you, Dr. Moses.
Good morning, everyone. Are you able to see my screen, Elizabeth? All right.
Yes, perfect.
Excellent. All right. Good morning, everyone. And thank you for the introduction, Elizabeth. As I was doing the final preparation of my slides for today, I realized that 45 minutes is a pretty long time to entertain people who aren't students, especially because we're keeping the questions to the end of the session. So I'll probably be using less than my allocated time, but perhaps the rest of the hour can be used for more expansive inputs into how we can improve the research that we're doing. So essentially, the goal of today's presentation is not only to share our findings on ECC enrollment gaps in post-COVID South Africa, but also to improve our research based on your experience in the sector. So that's either as practitioners, activists, policymakers, or researchers. So the rights of children to health protection, survival, and development are articulated in Section 28 of the South African Constitution. And so this is where the provision of quality ECCE or ECD plays a valuable role, not only in terms of stimulation, education, and nutrition, but then also in terms of holistic development of the child. The childcare aspect of ECCE also allows parents to participate more fully in the labor market, which in a high unemployment, high gender inequality environments such as we have in South Africa is particularly important. And of course, I suppose everybody here knows about the possible social benefits as well of ECCE, all of which make ECCE an important sector for social development. But despite these well-documented benefits of ECD or ECCE in the international context, in 2022, only 40% of the children in our sample between the ages of 0 and 5 years were enrolled in some sort of ECD program in South Africa. And so while we expect that some of that is due to access and affordability that constrain enrollment, we actually have relatively little empirical evidence of which factors are associated with poor enrollment. And so that essentially is the focus of this paper. In the period immediately after COVID, what are the demand and supply factors associated with low enrollment rates in ECCE programs in South Africa? So to answer that question, we use the General Household Survey of 2022, and that gives us the following information. It tells us whether a child is enrolled or not, in which type of ECD facility they're enrolled in or not, and then the factors which we think are associated with enrollment or non-enrollment. And those factors include stuff such as household income. So we assume that richer households are more able to enroll children. Mother's educational attainment, and here we assume that the more educated the mother is, the more likely it is that she'll understand the benefits of ECD. But beyond that, educational attainment is also associated with household income as well. So generally speaking, more educated people generally have a higher socioeconomic status as well, which also allows them more freedom to be able to enroll their children. Then also the marital status of the primary caregiver, and I'll talk about that later. So we've got extremely high rates of single parenthood in South Africa. And obviously that can influence enrollment in a number of ways. Then also, because we've got an extremely high unemployment rate in South Africa as well, it's important to look at other household members and their labor market status as well. So the assumption is that if you've got unemployed or economically inactive people within your household, those people can possibly look after your children as well, instead of you having to send your child to an ECD center. And obviously that can have either good outcomes or bad outcomes as well. Then one also expects that as a child ages, the probability of enrollment will increase. And then other things that we can also get from the GHS is the geographical factors. And that includes stuff such as the ward in which the child lives. So it's a relatively small area, as well as the province and the area type as well. All right, now one can combine this data from the GHS with data from the ECD Census 2021. And so the census tells us a bit about the supply side of ECCE. And what we're going to look at specifically in this paper is the location and registration status of ECD learning programs. So if you're not familiar with the ECCE census, between August 2021 and February 2022, the ECCE census aimed to collect data on all registered and unregistered early learning programs within South Africa. And the purpose of that was to integrate that data into the Department of Basic Education's Central Information Management System, or EMIS. So in total, the census collected data on 42,420 early learning programs. But what is important to note is that the data was collected in the period directly after severe COVID-19 restrictions. And so a lot of us know about how the sector was affected by the COVID-19 restrictions. And so what we expect is that the number that we've got here is probably an undercount of all of the programs in South Africa. And then very important to note is that all programs excluding grade R were enumerated. So any program that had grade R in it, that was attached to a school or even unattached to a school, was not enumerated. Okay, so before we get started, looking at the demand supply factors that affect enrollment, it's probably useful to define what we mean when we say ECCE center. So the definition of ECCE or ECD center in this paper is exactly as is defined in the 2013 audit of ECD centers report. And basically it says in that report that an ECD center is defined as a creche, daycare center for young children, a preschool, and or after-school care. And what they exclude are grade R classes that are attached to a primary school, home-based programs with less than 6 children run by day mothers, and childminders and or playgroups for the purposes of the audit, those with no children under the age of 6. All right, so using that definition then, if we look at our sample from the GHS 2022 data, we're defining kids between the ages of 0 and 5 years as being enrolled if they're in preschools, nursery schools, creches, or educare centers. So these are the teal and tan bars, which collectively add up to 33.5% of our sample. And then kids are defined as not being enrolled if they're at home, or in other words, not enrolled in any ECCE modality, or if they're staying with a day mother, gogo, or childminder, or at or using a home or community playground. So this is what enrollment in a preschool, creche, or educare center looked like between 2013 and 2022. And so what you can see over here is, if you keep your eyes on the teal and the tan bars, is that enrollment in ECD centers increased from 29.3% in 2013 to a high of about 37, 38% by 2018 and 2019. And then COVID happened, and enrollment dropped to about 26.5%. And so although we've seen a recovery since then, by 2022, enrollment had still not reached its pre-COVID levels. So I've mentioned in my introduction that about 40% of kids between 0 and 5 years were enrolled in ECCE in 2022. And so if one asks respondents what the main reason for children not being enrolled in ECD is, the overwhelming response that caregivers give is that they prefer to keep their kids at home or with someone they know. And that's illustrated here by these blue parts of these bars over here. I've done this by quintile. And what one can see over here is that the preference increases as income increases. All right, so the overwhelming response is that caregivers prefer to keep their kids at home or with someone they know. And that preference, and I've not shown it here, for keeping children at home declines as the child ages. And obviously as they get more learning needs, or the learning needs become more apparent. Of less importance is the unavailability of ECD programs. Right, so if you have a look at the orange parts of the bar, the light orange parts of the bar, that's where it says the facilities do not exist. And that constitutes a very small part of the reason, or a very small proportion of the main reason why kids are kept at home. And then also of slightly more importance, but not as important as the preference for keeping children at home, is the affordability of ECD programs. So it's a relatively small percentage of households that report that facilities are too expensive. Obviously, that proportion declines as income gets to the higher points of the year. But it seems like, based on this, that affordability is not a constraint. But of course, the problem with this question is the way it's asked in GHS, right? So it only asks for the main reason why the child's at home. But it may be that respondents are keeping the child home for a combination of reasons. And it could also be that respondents are reluctant to report affordability as a constraint as well. One gets some sense of affordability constraint if one looks at enrollment rates by household income. And so there are very clear differences between the rich and the poor. So on the y-axis over here, we've got the child's age. And then we've got these different lines over here that represent the income quintile of the household. So what one sees over here, or what I'll show very shortly, is that there are very clear differences between the rich and the poor. So this thick red line over here shows the enrollment rate by age of children in quintile 1, or in the poorest 20% of households. And as one expects, the enrollment rates increase as the child ages from 0 to 5. Okay, so this is the poorest 20% of households. And then this is the next richest 20% of households. And this is the next richest 20% of households, and so on, until we get to quintile 5, which is this thick blue line that shows children in the richest 20% of households. And so what we can see over here is an approximately 30 percentage point difference between the richest and poorest households that starts already at age 1 and then persists up until the age of 5 years. Now, there could be a few reasons for these enrollment differences between poor and rich households. Firstly, it could be that ECCE programs actually are too expensive for these households to afford. Secondly, it could be that poorer children live further away from ECCE programs. So one expects that living in a rural area is correlated with high poverty. Then one can expect that you'd have less access to ECCE programs simply because you live in a remote area and you happen to be poor as well. Thirdly, poor households could be more likely to have someone at home to look after preschool-aged children, and so this is what we expect, is that in poor households who have weak links to the labor market, there are people at home that can look after preschool-aged children. And perhaps the returns to the labor market in those households are not high enough for those households to participate, or at least the individuals in those households to participate in the labor market. And then a fourth reason could be that the benefits of ECD to the child and the parent are more clearly visible to more educated caregivers. And more educated caregivers we expect are probably better off financially as well. And so because of that, you could have this correlation between income and enrollment as well. So that's on the demand side. And when we look at the supply factors affecting enrollment, we consider how many children live close enough to an ECD center. And so in this map over here, you can see the number of ECD centers by ward. And so the provision of these are the registered centers by ward. And so the provision of registered ECCE facilities is quite unevenly distributed across South Africa's wards. You can see over here that it's most concentrated in the urban areas. So it's Gauteng, but perhaps also in Limpopo as well, which is more rural, but then also within the Cape. And less so it's less concentrated in most of the rural areas or less populated areas. And the reason for that concentration is possibly because of lower likelihoods of family support in urban areas, but also probably higher probabilities of employment in urban areas as well, which itself could be related to higher rates of enrollment in formal ECCE facilities. This next map over here shows both registered and unregistered ECCE centers by ward. And if you contrast this with that previous map, it shows you how limited access to ECCE would be if unregistered centers were prohibited from operating. So you can see that the concentrations are much higher and much more evenly distributed than it is for registered centers. Now, this is an alternative representation of ECCE center supply, and this is where we look at ECCE centers per square kilometer by ward. So it's simply taking the number of ECCE centers and then dividing it by the area of the ward. And here you can see again, ECCE facilities are most concentrated in urban areas and less so in rural areas. So one would expect that children living in less population dense areas, such as rural areas, traditional authority areas or farms, are going to have less access to an ECD center nearby. Right. So we expect that as the mother's educational attainment increases, that they're more likely to enroll their child in ECD. One of the reasons could be because the mother is more aware of the benefits, but it could also be that the mother has better employment probabilities as well, and because of that, would then need to enroll their child in ECD. Right. And what one can see over here is, so these are the different education categories running from no education to having an honors or higher. You can actually see that enrollment rates generally do increase as the mother's educational attainment increases. Right. Now, this over here shows you the parent or caregiver marital status. And I've divided this here by area type as well. So these are these three columns over here, but then also by population group as well. And so one expects that where both parents live in the same household as the child, there may be less pressure for one of the parents to return to work after childbirth, for example. Right. But then in contrast, where there's only one parent who's present in the household, the childcare burden may be in direct conflict with work or work-seeking activities. And so one would expect then that single parenthood would increase the probability of enrollment. However, it's also possible that single parenthood could mean low household incomes as well. And that affordability constraint could then mean that the parent could choose to look after the child themselves. Right. So the single parenthood can possibly influence enrollment probability in a negative way or in a positive way. So if one looks at this graph that shows the caregiver marital status by population group and area type, and if one just looks at the urban areas first, right? And so it's this block over here. Just over 90% of Asian and white children live in households where their caregivers are married or living with a partner. And if you contrast that with Black and colored children in the same age group, you can see that only half of colored and Black children in the same age group in urban areas live with caregivers who are married or living with a partner. Right. And so one expects that marital status is going to influence the probability of enrollment as well. Right, so just based on our descriptive analysis, the things that we want to throw into regression are the following. Child age, which we expect is positively associated or positively affects enrollment. There may be gender differences as well. If one believes that male children or female children are more likely to receive investments in education than the other. Then population group as well. And so the idea with that is not to say anything deterministic about the population group, but simply to account for the historical and present inequalities in South Africa that are still almost inextricably linked to socioeconomic outcomes. Then caregivers' marital status, and that can either negatively or positively affect the probability of enrollment. We expect that household per capita income is positively associated. Mother's educational attainment we expect is positively associated as well. And then having someone who is economically inactive or unemployed in the household, we expect is going to reduce the probability of enrollment. And that's because that person can probably look after the child and in that way prevent enrollment as well. And then having access to a center nearby, we expect is going to be positively associated with enrollment, regardless of whether that center is going to be registered or unregistered. Okay, so those are the things that one can throw into regression. So in a regression analysis to see which factors are most strongly associated with enrollment. These are those factors over here. And so just a caveat. So these are not causal estimates, but rather it shows the factors that are associated with enrollment after controlling for other variables. So the reference group is at the top of each category. And that shows the group that we're comparing other groups against. Right? That bold line in the middle, that bold green line over here, that shows you the reference value, which we set at 0. So anything to the right of this green line means that the variable value is the variable affects the probability of enrollment positively. And anything to the left of it means that enrollment is affected negatively. So one can start by looking at age. So you can see over here, the reference group over here is children who are aged 0 years. And what one can see over here is that as the child ages from 1 to 5, you can see that the probability of enrollment increases relative to that reference group of 0 years. Right, then one can look at race or population group as well. And so here the reference group is the Black population group. Colored children are less likely to be enrolled, or the probability of enrollment is decreased if the child is colored relative to Black. For Indian and Asian kids as well, the probability of enrollment decreases. And then white children are most likely to be, or to have white children have the highest probability of being enrolled. When it looks at gender difference by child, there are no differences. But if one looks at household income, and the income we've divided up into quintiles, quintile 1 is the base group over here. You can see that as the household becomes richer, or as household income increases, the probability of enrollment increases as well. All right. So in terms of the caregiver's marital status, here the reference group is the caregiver being single. If the caregiver lives with a partner, the probability of the child being enrolled is less than if the caregiver was single. Right, and then one can look at education as well, and here one can see immediately that as the mother's or the primary caregiver's level of education increases, so does the probability of enrollment. Right, and then having an adult who is not working or attending school and who stays at home, reduces the probability of enrollment. And so what's significant about this is that household income is controlled for already. So there's a possibility that households use these unemployed adults in their home to look after children while the other people are at work or looking for work. And so this is an area of research that needs to be explored to determine what the household labor allocation and household composition decisions are that make this association possible. And then, as expected, having an ECD center nearby, whether it's registered or unregistered, are positively associated with enrollment rates. Right, and the benchmark we've used over here is whether an ECD center is within 2 kilometers of the household. So in conclusion, so what we find on the supply side is having an ECD program of any kind within 2 kilometers of the household increases the probability of enrollment quite substantially. We also find that the mother's educational attainment matters, and so does the household income. And both of those are positively associated with the probability of enrollment. And enrollment is lower when children have two parents, and in households where there is an unemployed adult or economically inactive person in the household. And so given the huge impact of COVID on enrollment and the slow recovery since then, and our persistently high unemployment rates, it's extremely important that subsidies reach more ECD programs and children so that the enrollment gains over the last decade are not reversed. And the financial constraints may also point to a need for more pragmatic modalities being rolled out. So that's financial constraints, not only in terms of the household, but then also in terms of the private providers of ECCE. So that may point to a need for more pragmatic modalities being rolled out, especially in areas where you've got diseconomies of scale and where it makes large-scale, high-intensity ECCE programs more difficult to supply immediately. And then just finally, as a suggestion, given that South Africa's got an extremely high level of unemployment and single parenthood as well, it would be nice to do further research on the relationships between single parenthood, labor market outcomes, and enrollment as well. Thank you. That's the end of my presentation.
Thank you so much, Dr. Moses. That was a really exciting and interesting presentation. I totally agree with Laura in the chat. That is a really nice way to present regression analysis results for those of us that are not economists or deep in the data analysis. It's very easy to follow. All right, colleagues, we are at that stage. If you have comments, questions, inputs, additions, we will take it. You can raise your hands and we'll give you the opportunity to engage. But perhaps while you were presenting the regression results, Dr. Moses, I was wondering perhaps if there might have been an interaction effect, if you had explored it, or if perhaps there could be a way that two variables or variables combine to, increase or decrease the probability of enrollment happening for the sample that you're looking at. I wonder if you have something to say about that before we go into the audience for their comments and questions. Thanks.
Right. Yeah, so just to answer that, I didn't play with interactions. Well, I did, but not formally in the paper. And the reason why is because a lot of these things are so correlated. And so it's difficult to, I mean, one can do it. I mean, I've played around with income quintile and then area type as well. But perhaps Yeah, I haven't presented in the paper, but perhaps I can add that as well at some point to a future version of the paper.
All right, thank you. So I see a hand, Pam Picken. You can please unmute and ask your question or comment, give your comment.
Hi, sorry, I couldn't find how to unmute. Thank you, that was really interesting. For me, looking at some of the things that can be done, and particularly in view of the large numbers of unemployed adults in the home, it raises the importance of the critical importance of a general information giving campaign, radio campaigns, and so on the importance of the early years, and parent support programs, and also I would think 2 dyad play groups that include an adult. And I think there's an interesting example. In 2005, Tree won or came second in a global award for 2 dyads play groups that included a caregiver, and part of the session the caregivers played with the children under the guidance of a facilitator, and then they split and the children continued to play and the adults underwent a parenting program, and it worked really well after quite a slow start. I'd be interested in your or anyone else's comments.
Yeah, I think it's a great comment, Pam. Yeah, I also think it would be a great idea if one had smaller scale programs, especially high quality ones. But it would be nice to hear from other people as well what they think about it. Yeah.
I see Laura's comments. Laura, would you like to unmute and perhaps expand on what you are seeing in terms of the impact of having an employed adult at home and what that means for younger children?
Sure, thanks, Liz. Yeah, my comments are just, I guess, regarding some of the underlying assumptions that seem to be in the way the design is set up, Eldridge. That, in a sense, you're imposing the view that enrollment is desirable for all children in all of these ages, and obviously, depending on the circumstances, if it's possible for a younger child, 0 to 2 years, to be at home with a caring parent or caring family member or adult, that's actually more desirable in many cases than enrollment in a group learning program, especially if those programs have older children in them, not necessarily tailored for younger children. And so I think, at the very least, separating out this analysis for 0 to 2-year-olds and then 3 to 5-year-olds would be super interesting, because we'd probably celebrate lower enrollment for younger children if there is at least one unemployed adult in the home, or it would be, that I think that would be, we would look at those results differently for 0 to 2-year-olds and 3 to 5-year-olds and make different inferences about what we're seeing. So I think that would be something really useful to look at.
Thanks for the great comments, Lauren. I actually have added that in the appendix of the paper. Just trying to get the view right here now.
Cool.
Right, so I've separated here for 0 to 2 and 3 to 5. And it's, as you mentioned, a lot of the coefficients that we did see for the overall sample then become insignificant as well for the 0 to 2. So it seems like there are different factors that drive enrollment for the 0 to 2 than it does for the older category of kids, 3 to 5 years. Yeah, so a lot of the results is driven by
That's
the
great.
older age categories as well. Yeah, it's difficult to get a handle on which what the upper age limit should be. So in some cases, people say the upper age limit should be 6. In some cases, it's 5, and some it's 4. And it's probably useful when all of us do this kind of work to probably present all of the possible age categories, just so that we can sort of nuance whatever it is that we find as well. So thanks for that great comment. It is something that we discussed with Colin as well.
Yeah, and Eldridge, to your point about like where the upper age limit is, and then it also comes to like which programs you're including in your definition of access or enrollment. It's like, you know, for 5-year-olds, some of those we would logically be enrolled in a grade R program. And so that then becomes like a really tricky age group to make decisions about. And then, yeah, that does become really complex. I recognize that completely.
Thanks for the great comments, Laura.
All right. So we have a question from Fiona. I wonder if she can unmute to ask a question instead of me just reading it. If you're comfortable with asking your question, you can unmute, Fiona.
Thank you very much. So I was interested in, I mean, there obviously you have a limited number of variables that you've considered, and I assume that's got a lot to do with the sources of data that are available. But one of the things I think that is really important to consider, and it's not the same as mothers' education levels or the economic status or the quintile in which a child sits, but is the consideration by parents and caregivers of the quality of the offering that is available to them. So it's not, again, not just access. So even if a parent or caregiver has access to some kind of early learning program in a centre, they may choose, with a perfectly nuanced understanding of what quality means to them, they may choose not to enroll their child because they conceive that the program itself is not worth paying money for, or not worth sending their child for. The facilities in which the program is being provided may be unsafe or unhygienic, and multiple other variants on that. So bearing in mind that the answer is possibly no, I am interested if you think that other variables such as quality of provision could be included in further analysis. Thank you.
Thanks. Yeah, that's a great question, Fiona. I think it would actually enrich analysis, and one can get a sense of quality from the ECD census about the actual quality. But so that would probably be a more objective valuation of quality than what the household would perceive. As obviously people make decisions based on the perceptions rather than what is. And one expects that perceptions or the ability to evaluate a program is probably going to differ amongst different households. So that would enrich the analysis. I can do that. The only sort of proxy that I used for quality over here was whether the program was registered or not. And so one assumes implicitly that the registration process, as imperfect as it is, would separate the programs in terms of quality. But obviously there's a lot of imperfections in that. So it probably would be better to interrogate the ECD census data a bit more, to interrogate the quality of the programs available to people.
I wonder if there are perhaps, CAP studies that could be utilized as well for that.
CAP studies, right? I definitely will have a look at that. Thanks a lot, Fiona.
All right. So there's a question from Colin, and he wants to know, in future GHS surveys, what additional questions would you recommend asking to help improve our understanding? Specifically, you made mention of the reasons for not enrolling children was a bit, the phrasing might have probably elicited social desirable responses, or, people shying away from it. So how can we then improve that?
Yeah. I think in terms of an immediate wish list, thanks, Elizabeth and Colin, it would be that question, the main reason why children are not enrolled. If one can expand that to all of the reasons why you're not enrolling a child, and then possibly a ranking of that would be nice as well. Yeah. The other stuff, from a spatial point of view, I suppose would be the exact location of the household. Because at the moment, what we're doing is we know the ward in which the child lives. And so we're using the centroid of that ward to basically say that's where the child lives. But it would be nice to get a sort of exact idea of where children live. And so that obviously is impossible for anonymity reasons. But that would be on my wish list. Yeah. Thanks.
Interesting. I see in the chat box, Kate is referring to, I'm not quite sure what differences the comment is based on. If you are comfortable unmuting to maybe give your comment and perhaps explain or give us a little bit more context, it will be great. Kate, otherwise, no pressure. If you're trying to speak, you're still unmuted. All right. So while we are waiting for people to unmute. Oh, here you are, Kate. Go ahead.
Hi, thank you very much. I'm sorry, I joined a bit late, and I get that I'm probably coming from a different point of view because I'm not trained in this field. But I was curious because my query was around the fact that the neurodevelopment and sort of child development at between 0 to 2 is so different to after 3. But also, sorry, I'm a bit ADD, so my brain's going all over the place. But so the idea that enrollment is a good idea from very young, but we've kind of dealt with it already by looking at the fact that parents might have various reasons for enrolling or not enrolling, and that the general model is accepted that, well, the general idea is that it's much better if you can be at home, or if there is somebody who can be at home with the child. So I was curious about the sort of clumping, I suppose, the grouping, but it was just an observation. It wasn't really a comment. I mean, it wasn't really a question. It's just, I think in terms of, yeah, and I wondered if where the data sources had come from. So I probably need to go back and look at what you've done in more detail.
Yeah, so just to answer your question, Kate, most of the data comes from GHS in terms of the child and household characteristics. But then on the supply side, the data comes from the ECD Census 2021. Yeah.
Okay.
And so I think most of us are in agreement that 0 to 2 and 3 to 5 year olds should be treated separately. And it's something I have done. And in fact, a lot of the results that I've got here are actually driven by the 3 to 5 year old category rather than the 0 to 2.
Okay, thank you. That's interesting. I suppose I'm also thinking of models that I've heard of that I wondered about in terms of collecting their data specifically and whether they participated, but I can go and do the research myself. Things like the Bulungula projects in the Eastern Cape and others of similar nature, but which are tackling things in different ways. Anyway, but I'll dig in a bit more. Thank you very much. It's been very interesting.
Yeah, what one does pick up from the data, I mean, even just looking at the main reason for why people keep kids at home, is that the preference for keeping children at home just because parents want to be close to their child, that is quite high. from 0 to 2, and then declines as the child ages. So it's a relatively predictable pattern of preference that declines as the child ages.
All right, thank you. And Kate, the full paper is also available for you to read and engage with. The link is in the comment section to get access to it. I wonder if, Colin, you can unmute and ask your question this time round.
Unmute. Sure, I can unmute. So I was, thanks, Eldridge. I think others also have appreciated the I guess, simple way that you've presented this. I wanted to ask a question. In the paper in regression 4, where you've looked at, and also I think here, where you've looked here, what's also here, registered, the impact of registered within 2 kilometers, unregistered within 2 kilometers, and then registered and unregistered. Like,
Yes.
I'm trying to think about what that's actually saying. Is it saying that, I guess, proximity is the only thing that matters, rather than, and I guess, or availability is the only thing that matters, regardless of what type of program it is? And then is this maybe also saying something about that it's out of necessity that they send children, that parents choose to send children, rather than the value placed on the kind of the benefits of a early childhood development program?
Yeah, it could be because parents are forced to send their children to different centers. I mean, one can read it that way. But then it could also be that parents at different levels of income or different levels of educational attainment value registration differently, or may not be able to see the differences between registered and unregistered centers. Or it could also be imperfections in the registration system as well, where the quality of the center may be high, but the center is just not registered as well. So it's a very sort of crude way of it's a very crude proxy for quality, because of all of the imperfections in perception from the household side, but then also probably from the compliance and registration side as well of the center.
I see Elena has an interesting question in the comment. I wonder if she's comfortable asking it.
Hi, yeah.
Yes, hi.
Thank you for the presentation. It was super insightful. I was wondering if there were any important variables we can actually look at within a ward or a municipality to start anticipating demand in a location, if it was the case that quality ECCE ELPs become available. Because I know we can kind of map the supply, but I was wondering if there was something that we can look at in terms of demand.
Yeah, it's I mean, using household surveys, it's going to be very difficult to map the or project demand. One of the reasons is because the GHS, for example, this is what we used here, is not really representative at the ward level. So when one does analysis of this sort, generally, we try not to use weights because we know that it's going to be sort of distorted at the ward level. The data that could help one sort of project demand would probably be the census, because that would give us some indication of who's living at the ward level and the demographic makeup of people living at the ward level. The problem at the moment is that census 22, firstly, hasn't been released yet. So that's the one issue. And then the second issue is the reason why it hasn't been released. It's because a lot of people don't think that the estimates at the lower levels of aggregation are reliable. So it's going to take some time to to sort of get that data set and probably get it in a shape that's useful for analysis. So I think the only way that one can get estimates of demand at such a low level would probably be through revealed demand. And when I say revealed demand, it's more that the households are actually, asking for services. Yeah. So from the survey data, it's going to be very difficult to project at the ward level what the demand is going to be.
Mhm. Yeah, thank you. Thank you for that answer.
Right.
All right. There's a question from Pam, and I'm going to throw it at you, Eldridge, but I also invite other perspectives and comments from the floor. And she's wanting to know, are there any indications as to the reasons why there is still a significant drop in enrollment from pre-COVID levels? So you can give us from your end, based on your analysis and experience, and then I'll also throw the same question to the floor for others, colleagues who are on the ground dealing with this on a day-to-day basis, practitioners, to give us another take on it as well. Thanks.
Yeah, so we're seeing it from the GHS perspective, and sometimes the numbers don't match. We've seen this with work from Gabrielle Wells, for example, recently, where she's looked at enrollment estimates, and those can vary quite a bit depending on the data set. But what we do see from the GHS, if one is to believe that, is that there has been a recovery of some sort since 2020. It's not yet at pre-COVID levels, but we have seen an increase since 2020. Yeah. And then I suppose it also matters, one should probably include children who are enrolled in grade R as well, and in grade 1 when one looks at the analysis, which this analysis does not do. Yeah. But based on the sample that we're analyzing, we have seen a slight increase in enrollment, but not yet to pre-COVID levels.
All right. Is there anybody else in the group who has a different take or another perspective on this specific question? Why we are still seeing a significant drop in enrollment to pre-COVID levels that you would like to share? All right. So, Dr. Eldridge, what is the take-home message? From what you have shared, we've looked at various socioeconomic factors that influence supply side and demand side issues that is affecting or influencing enrollment gaps in the country. So when we leave here, what is your one-liner, your last sales pitch from this paper?
Yeah, I suppose, yeah. So the one thing I recognize is that the Department of Education, who's now taken over the role of ECD, is going to have a gargantuan task, just in terms of the administration of ECD, and then getting it in shape so that eventually that one has a compulsory grade RR at some stage as well. I do think that ECD centers need more help in terms of becoming compliant. And then perhaps one should also look at the red tape around that as well, in terms of facilitating their transition from unregistered to registered, because the subsidy at the moment, even which didn't increase for a very long time in real terms, that needs to be extended to more ECD centers, but then also in larger amounts as well. And the reason for that is, if one looks at the data here, is that you can see that there are clear differences between poor households and rich households. And so it's important that we're able to subsidize those households who don't really have a choice in terms of enrollment or not.
All right. Thank you so much for a very interesting and engaging conversation on enrollment gaps in early learning, and we have learned a lot. And folks, the paper is available on our website. If you go to Lifa Labantwana, the working paper and webinar series tab, you will see the paper is there. Please download it. It's free of charge. And this brings us to the end of today's discussion. Join us again next month, 6th of November, for another interesting and engaging learning session where we explore all things early childhood development. Thank you. Thank you, Dr. Eldridge Moses.
Thanks for having me, Elizabeth. All the best, everybody. Bye.